Managing health outcomes of patient populations is taking on greater significance in large pharmaceutical companies as competition increases and greater cost control takes hold in the marketplace. Hello, we're going to talk about how SAS Visual Analytics can transform the health economic outcomes research, or HEOR, process within large pharma by demonstrating how their drugs can provide more value in the marketplace. We are going to give an overview of what HEOR is and then do a demonstration of SAS Visual Analytics. HEOR is the process whereby pharmaceutical companies use data to fully understand the economic value their product provides in the healthcare market, the superior efficacy of their products, identify competitive advantage, and discover additional uses and therapies. What is the value proposition for health economic outcomes research? First, it is big data. It is longitudinal and multi-dimensional care data. It is cost insights and risk mitigation to healthcare providers, payers, physicians, and most importantly, patients. It identifies and acts on subpopulations of at-risk patients, improved healthcare and outcomes to underserved patient populations, and it is discovering additional indications for current brands in the portfolio and ways to gain market access versus a competitor. Diabetes is a serious health issue in this country. Almost 26 million children and adults in the United States, or 8.3% of the population, have diabetes. Another 79 million are pre-diabetic. Today, we are going to use SAS Visual Analytics to help us understand our diabetic patient populations and the diabetes drug market. We are going to use a lot of data and are going to focus on the cholesterol ratio, which is calculated by dividing your total cholesterol level by the HDL cholesterol level. Let's get started with SAS Visual Analytics.
Once I log on to Visual Analytics, I get to the hub here, and it gives me all my previously made explorations and reports here. But if I want to start a new one, I could just click on Explore Data. It's going to ask me for a data source. As it's logging on here, I need to select the data set. So the data set I'm going to select is the health outcomes data. Once I open that up, it's going to pull into a visual exploration window. So what we're looking on the left-hand side is all the data elements. We have categories, hierarchies, time, dimensions. So the first thing I want to look at is kind of our A1C measure over time. So I'm going to grab my date, and then I'm going to change my measure to be A1C, blood sugar level, and aggregate this by average. So we want to see the average blood sugar over time. So we can see that most patients, or all our patients, 350,000 diabetes patients, start up above 6.6% blood sugar level, which is not good. We want to get them down here in the 5 and below. So the trend line is encouraging around that. What we also want to do, we can really quickly see, this is a quick snapshot of the whole population over time. And then with 2 clicks, one click down, one click show forecast, we're going to forecast out to the future how these patients are going to progress over time. Really quickly, what this is predicted values of the measure A1C over time, and we're looking at an exponential smoothing with a dampening trend. Statistics, forecasting, and predictive algorithms. Forecasting specifically, in this example, forecasts the percentage of where these patients will be with their blood sugars if they continue on their therapy. So that's interesting, except that we have the whole market. We want to see how our drug, Why Are You So Sassy, where that stands within this market. I'm going to pull out drug type or drug name and pull it into my filter area, drop it in here. So that shows me all the drugs that are out there. The size of this bar on the left-hand side shows you how many patients, or the percentage of the population that fits it. So some of these are pretty small. Generic is obviously the largest. Why Are You So Sassy? We have a pretty good market share. So if I want to see specifically, let's see specifically how generics are doing. The generics are doing pretty well. We have a little bit of volatility here, but the trend is going down into the 5s, which is good. About 6, and then in the future, getting down into the 5s. Let's compare and contrast that versus ours. So let's unselect this and let's select why are you so sassy. We'll update the graph that way. You can see of all the patients, we have about 13% of the population. You can see our trend is stronger because we start at the same spot here, 6.8%. But when we get to the real end of our real data, 2 years of data, we're at 4.5% of our actual. It's right there. And then where we're getting forecasted out is even better. So I'm going to do a correlation analysis. Let's look at patient age, blood sugar, and let's look at the cholesterol ratio. We're just going to do a quick correlation analysis by dragging these over here, and it's automatically going to create a correlation. I like to change the colors so that red means bad. Take a closer look at that. So I'm just going to change my gradients so that green is good, red is bad. Same correlation analysis here. So we have all these different measures in here. Here's our cholesterol ratio based on blood sugar level. So this is a correlation that's not a good correlation because it's strongly correlated, the two are. And let's take a look at this subset. The rest of these are green, which means there's not really any strong correlation. Some of these are financial metrics, so a final out-of-pocket payments is strongly correlated to patients out of the pocket. So that makes sense. It should be. Those are by definition collinear. So let's look at this hot pocket here. All I have to do is double click on this link, and it's going to open this specific box, kind of a regression line here. Let me resize this so we could take a better look. This color again. So the same. So we have this. We're looking at the same colors. Okay. So again, we have some strong correlated pockets here of cholesterol ratio and A1C. But remember, we don't really care if it's below 6, 5, and 4 is good. If you remember from the slideshow, cholesterol ratio of 4 is good. 5 and above is bad. So if we look here at this one pocket right on the trend line, this is not good news for us. This is a subpopulation that's at risk because our cholesterol is at a 6 and our blood sugar is at between 8.3 and 8.5. So there's 10,000 patients in this subset that we need to do a further deep dive into. So the best way to do this is just to kind of export that data, and you just right click on that hot slot and select export that data, and then say and it'll save it off onto my hard drive or off onto the server somewhere so I can take a look at these specific patients. Okay, so really quickly, I've honed in on a possible safety issue within this 10,000 group subpopulation within the 350,000 patients that we're looking at. So let's do some visual analytics across the multi-dimensions within this data. So I'm going to pull out this hierarchy, and it's looking at things by age group. I'm going to change my measure to A1C, our blood sugar level. Because it's A1C, we want aggregation to be average. So we have some bar charts here. So I'm going to change my visualization type to a box plot. And now it tells us a little bit more. The first bar chart didn't tell us much. The box plot is a little bit more informational. And you can see here that our 60 and over is our biggest box, and it's our highest level of average of A1C blood level. So let's click into this box and expand it based on our hierarchy. And we can see here that Medicaid Part D is probably our biggest population, or close to it. So let's click into that one, and it's telling me that I've reached the end of my hierarchy. Is my analysis done? No, not by a long ways. I can quickly edit this hierarchy and change it on the fly. So let's say I want to look at it by, not just by payer type, but I want to look at the drug. So I want to see how Why Are You So Sassy is doing, how it's doing across payer types. And I also want to look at, maybe the payer and plan that's helping pay for the Medicaid Part D drug. So let's pull that out into the hierarchy and update it. My hierarchy has been updated, and I can go right down the same drill path where I got stuck before in Medicaid Part D, and it pops open to what I've just added into there, which is the specific drug names. I can actually look at a table. So to easily add a table to this analysis, I just click on this table, and the table is open. And what I find interesting is you could actually stack up these bar charts as the table direction just by changing the box direction to horizontal from vertical. And now we have everything looks the same. Our drugs are in order and our bar charts are in order. So the one that we care about the most is why are you so sassy? So if I double click into why are you so sassy, now it's going to get really, really big, because now we're looking at every single payer group, payer plan, etc., that the Part D Medicare comes through the payments. Interesting, or more viewable, I should say, instead of interesting. I'm going to sort this by descending average. So now the top ones for our drug within the plans are going to pop up top. So this gets a little bit more telling. So now these ones at the top of the graph, I'm going to zoom in here. Just continue to zoom in and go to the top. And these are the ones that are driving the prescriptions through Medicare Part D. Within these plans, there's an opportunity. Quickly, I can kind of hone in on where our opportunity for growth within these specific plans. Okay, we've seen that our drug, Sasentia, is much more effective. There's very little risk, and we see that there's a commercial opportunity in different health plans and payer groups. But let's look at it at those 4 dimensions all in one to get a better, clearer picture of where the commercial and the revenue opportunities are for our drugs. So what we want to do is create a 3-dimensional bubble plot. So the first dimension is our x-axis, is we want to measure, our A1C, which is the blood sugar. The second thing we want to measure is our cholesterol level, and that's kind of a safety signal or a side effect we want to keep track of. So we're just going to put the bubble size on that. If the bubble size gets too big for a certain drug, then we know that's the problem. And then let's pull in a commercial measure. So let's take out market share by month, and let's use that as the y-axis. Okay, so we're going to track the market share on the vertical axis. Okay, so the blood sugar level, again, we want the aggregation to be average, and the market share we'll leave as a sum. Our drug that we want to check out is Sasentia. So I want to change, there's a couple ones that are green here, so I want to kind of change ours to be a little bit different so it stands out. So I'm going to change the color real quickly to something a little more brighter, a little happier. All right. And then we're looking at it, we're grouping them by drug name. And then the last thing I want to do is pull over the date. So we can kind of, this third dimension is going to be time. So we want to see what the market share is over time while still keeping track of A1C, so drug effectiveness and safety and all that. I'm going to click on this because this is kind of the market leader, generic, and you can see that by how high it is in the market. I'm going to click on that one, and I'm also going to click on our drug, Sasentia, and then I'm going to play this so we keep track of it over time. So as you can see, as time is going over the last 2 years, our A1C level is going down, and it's becoming more and more increasingly effective over the generic. Our market share has gone up a little, but not as much as it should be, given how effective and how safe our drug is. So the two that we track by the line are the generic, which is the market leader, and then our drug, which is clearly the more effective drug. So this gap between these two balls and these two lines is our opportunity. Quickly shows us where that opportunity is, that we can go into the different market plans, into the different payer plans, etc. within this diabetes market, new opportunities to promote our diabetes drug for safer and more effective diabetes for patients and better outcomes. Thank you.